I'm going to actually do a demo of our, what we call the Connie portal. That's where a lot of the data that is shared from many of your organizations actually will live for you to access and share. Really at HIE, we think of ourselves as like our healthcare ecosystem here in Connecticut, where maybe instead of doing a duplicate lab or radiology result, being able to go into several systems, right, in order to find information on patients, that it's more of a one-stop shop where you can see all of that information in one place. So let me go ahead and get logged into our portal. All right, so you'll see I'm already logged into, this is our web-based portal. So I'm already, it's our demo environment, our test environment. So I'm already logged in, but just so you know, the way that logins happen, or the way that you get provisioned in order to access the system, is, of course, you go through those 5 steps that Tony just shared, that onboarding process. Then when you actually go to the website, we do require 2-factor authentication. So we'll, once you kind of go through your data sharing agreements, we'll walk you through like how you actually access clinical data. But once you get in, once you're provisioned for the portal, and some organizations, I will say, they actually have this view that I'm going to show you today, right, integrated into their electronic medical record. So they don't go to a web-based portal per se. They have a launch that happens right from within their electronic medical record, or EMR. So that's something that we can talk with you about as we get into what we call technical onboarding, like how would you like to access this data. But today I'm in our demo system, our web-based portal. And really for most of our provider practices, when we get them access to the portal, we'll always let them know that when you get ready to search for any type of patient data, you'll need to have identifiers for that patient. So some are required, such as a name and date of birth, and you'll see that listed here by these asterisks, these red asterisks. But you can put in other information. That kind of, the more information that you put in the system, kind of the better match you'll get back. I know a big question that comes up too many times is, okay, Connie's available for me to access patient data, but how does Connie know that I have a relationship with this patient? How do we make sure that people are looking up information that they should have access to? And so just so you know, this is a panel-based system. So the way that it works is when we go through technical onboarding with you, we'll talk about a way that we can get a roster of your active patients. And those are like, so for example, the patient that I'm putting in today, Anna Cadence, is on my patient roster, right? Like my test patient roster. So when I put in Anna's information, which I'm gonna do now, so I put in her first and last name because that's required, and then her date of birth is 11/16/81, and then I hit search, or you can hit enter. Then I'll get a list of patients that come up that match, that demographics that I put in. I'll go ahead and you'll see, when I put in Anna's info, I kind of get a list of the different Anna Cadence records that are into the system, and I get a score of like, hey, is this the right patient, Anna Cadence? When you get your scores, typically, when I say score, match score, typically the most probable match is going to always come towards the top. More information you put in, once again, the better match you'll get. But once I'm going to go ahead into the top record, but I did just want to show you, just for reference, in the event that, let's say, someone put in Anna Cadence's date wrong, you'll notice that that this is now a possible match, because really her date of birth is 11/16/81, and then you have this record here that's 11/17. Could possibly be the same patient, maybe just whoever sent in that data didn't put in the right date of birth. But then you'll see here I get a really low match score because it's a totally different date of birth. So that's probably not the patient I'm looking for. So usually the match you're looking for is going to be right at the top. And in this case, we've validated because we've had Anna's name and date of birth here. And once again, Anna is a patient on my roster. So I kind of know Anna because she's one of the patients right in my practice. So here we're going to go into what we call clinical information. Once again, this is our test environment. So I'll walk you through the information that is being sent to Connie that is available for viewing for HIPAA covered entities that we're working with now onboarding. So once again, I'm going to go ahead and select Anna. You'll notice once again, as I put in Anna's information, she's kind of coming right up for me. If Anna, let's say, wasn't on my patient panel, then I would get a message that before I'm even able to get into Anna's chart that tells me, hey, Lakeisha, I see you're searching for this patient. Yep, you have their name and date of birth, but our system doesn't have a record of you having a relationship with this patient. And then I would need to do what's called breaking the glass in order to actually view that Anna's patient record. I mean, there are times where you'll have, of course, like new patients that won't necessarily be in your panel because they're brand new to you. And so I would choose, there's certain reasons why you can break the glass. So in that case scenario, I might say, this patient is totally new to me, and then I would be able to access the record. But I know that question comes up a lot, so I always like to talk about it ahead of time. In this case, Anna is on our roster, so we're able to go into our chart, but just wanted to address kind of that's how the panel-based system works. Is typically you'll have access to patients that are on your panel. You do have reasons, i.e. like a new patient, that you may need to look up a patient. You still, of course, need to have at least their full name and date of birth in order to do that. But you also have to do what we call breaking the glass if it is a patient that's not on your roster. All right, so we're now in Anna's patient chart. And I'll walk you through the different sections of her chart. So we've got first, we're going to start out with patient information, which is like demographic information on Anna. Then we're going to go into clinical data, which is like labs and radiology, transcribed documents that we have on the patient. We will go into medication management, which is kind of a new feature that really came out of our Connecticut healthcare provider community here that said, hey, it would be great if we could really have like a best possible, what we call best possible medication history. So I'll go into that. We'll talk a little bit about care coordination and how you can see other care team members that are also taking care of your patient. And then last but not least, we'll go into what we call PMP, the prescription monitoring program in Connecticut. We do have a connection to that system. I know many licensed providers already have access to that system, which is great. What we heard from some providers is that it would be great if while they're already in Connie, if they could also have that link out to PMP. So we do have that integration available for certain users. Once again, it's typically licensed providers that'll have the prescribers, I should say, that have access to PMP. So let's kick off with patient information. So patient information is where you will find demographic information on the patient. And this essentially is the most recent information that Connie has received from one of the data centers. What's nice is I've heard a lot of provider practices say, oh, this is great because, you know, maybe the number they have in their system is a little different than maybe what the most recent phone number is for one of their patients. So it's nice that you can kind of get the most recent demographic information available on the patient. This comes in directly from the various what we call data centers that are contributing to Connie. You can see a list of some of those data centers. These come in kind of under, once again, it's our test system under alias names, but this kind of gives you an idea of when you have a health information exchange, just all of those different touches, the specialists, the hospitals, different providers that are providing care. All of that information is now in one patient chart or patient record. And so that's essentially what this is showing you. Is these are all the various places that are sending in information on this patient, but we have it all here in one place. So we'll show you kind of where those different data center pieces go in the patient chart. But that's essentially what this is, just the different data centers that are contributing to the data that we have in here. The other piece that's in patient information is next of kin. So this once again comes directly from different data centers. And this is where we display what the data centers have as that particular patient's next of kin. So you'd at least have some contact information if needed to coordinate care with a family member. So that's patient information, demographic information. You've also got your next of kin. We're going to spend most of our time today in what we call clinical data. And so as many of your organizations, as you're listening today, you may be thinking of, oh, okay, what data do we send? What data are we able to either receive or view? These are the different types of data that I'm going to go through, clinical data that's available through Connie. So one, we start out at what we call encounters. So this is essentially letting you know a patient had an encounter with another provider organization. So we break these out into either hospital encounters or what we consider outpatient encounters. So hospital encounters, well, first, when you come into encounters, you get to see all the patient encounters, but many times you may specifically know maybe Anna was in the ED. And so you want to know at least one, that she was there, because you may not have even known that she was in the ED. But then two, of course, you may say, okay, well, what happened in the ED? So this encounters will essentially let you know that there was an encounter in in a hospital. And so I just went ahead specifically to the hospital tab to just look at the hospital encounters. But here you'll see, she recently had 2 emergency visits. And then it just gives you kind of a quick overview to say that she was there. This is kind of the, what was going on, or at least the chief complaint when she presented in the hospital. Alternatively, if I was looking for maybe a specialist or outpatient visit, then I would come over to outpatient visit. And once again, here I could see, the diagnosis code, discharge disposition, especially if this is an encounter that's already kind of been closed out. Sometimes when you have a patient that's kind of just going into the ED, these messages are near real time. So it may just be limited information that's available at that moment. But obviously, if maybe it's, primary care, you're visiting up or checking the Connie portal after the fact, that information gets updated. So you can kind of see like, okay, what was the discharge disposition? So many times you'll know how to follow up with the care for that patient. So once again, encounters just let you essentially know that the patient was there. But if you wanted to see like, okay, now I see the patient was in the hospital or was at another provider, what exactly happened during that visit? That's when you would go to this next tab of what we call our health records. And that's where you see labs, radiology. This is where you'll see what we call clinical notes, or you also hear them called the transcribed documents. We now have quite a few of our hospitals and labs, for that matter, lab partners in the state, sending in that are live with this data, really just because of, as Tony was talking about, the mandate to connect. The first group that we really wanted to start with were the hospitals and labs. So many of them had until May 2022 that just passed to at least start the process. And so we've got about 60% of our hospitals that are sending us real-time data, which is great. So you'll definitely see a lot of the data from the hospitals in here. Where now, as we go into what we call year 2 providers, really onboarding more of the ambulatory organizations, some of the skilled nursing facilities, et cetera. So you'll start to see more of that data also coming into our HIE here. But specifically under health records, you will find labs, radiology, and clinical notes. So if you wanted to just look at labs, you can go ahead and click on just the lab section. And now we only see labs in the list. You'll notice here, if there is an abnormal result as part of that lab, if it's a panel, then you'll have the orange flag that'll come up, and you just put your mouse right over it and it'll let you know there's an abnormal result. Sometimes that's nice if you really just want to hone in on, okay, lab was done. Let me just kind of see what we need to talk about or address. I'm going to click on that actual lab just because I did see there was an abnormal result in there. And here, this is where you'll see that full, this is the CBC panel. You would see the full panel, but then once again, you would see that flag for whatever may be abnormal in the panel quickly. If you wanted to download this as a PDF, you can do that. Just go ahead and download it. And then if your system allows you to export those type of documents in your EMR, then you'd have that information available. If this is like a result that maybe you didn't have because it was done elsewhere, that is an option. But then a lot of times, some folks are coming in here just to kind of, as they prep for a patient visit or as they're following up with the patient, just to kind of see, okay, what is the latest lab work that was done? Maybe they don't even have to repeat that lab if it was done somewhere else and still within a usable range. So all that's to say, this is our labs. Once again, anything abnormal will come up with a flag, and you are able to download that particular result as a PDF if you need it. The other section I'll show you, our next section is radiology. So what's nice with our radiology reports is we do have an option with many of our radiology partners. If they have a PACS system that also has images, in addition to the report, we can actually link out to their PACS system, and you can look at that image right from within the Connie portal too. So here now we're looking at, I've got labs and radiology going. I'm going to go ahead and sort this column because each of the columns, you can just click on them and they'll sort. The default is typically the most recent result to the oldest. But here I'm actually going to look at an older chest x-ray that was done. I'll click on the report itself. And so then that's where I see the written report. But I'm also going to go ahead and click on, you'll see this little camera icon. So if it is a radiology group or hospital, many of their radiology centers do also send images too, then you can just click on the camera icon and that'll launch out to the PACS system right there at the source. So here, this is where we see the actual chest x-ray coming up. This is nice because plenty of tools here that if you wanted to kind of measure or do your own markups on the particular image itself, you can do that right from within the Connie portal. It doesn't, this is just kind of for your viewing, so it's not actually, changing the source. But what we've seen with some of our other groups as we are rolling out image share is sometimes providers will even do, they'll put together what we call a work list, and you can actually invite another colleague that's on the portal, or obviously if you're accessing this from your EMR, you can invite another colleague to be on this same image with you, and you all can collaboratively work together. So that it's a newer tool for us. I think it's been really good to get feedback from High TAC committee here in Connecticut, and then also from some of our other stakeholders to say like, hey, this, we think we can do even more with image share. So I would say for those that are logging into the portal and at least know that a patient had images done, you do have the report itself, the written report. But for those orgs that are sharing their images too, you can actually go and view the image also right from here within the portal. The last section here we'll go over is clinical notes. And so clinical notes, once again, are more of those transcribed documents that are done. Typically, you'll see these coming from the hospitals, but we do have some of our other partners that are able to send in their clinical notes this way. I'll show you where most of the ambulatory information comes in. That's on the next tab we're going to go to. But what's nice here is anything in this section is you can search what we call do a dynamic search for maybe a keyword you're looking for. So for example, a lot of times when a patient's in the hospital, you may say, okay, well, what was the discharge notes, or what's my follow-up? So you can just kind of start typing in the word discharge, and then anywhere within the health record that word appears, you'll get a match there. So I'm going to go ahead, I just typed in discharge. I'm going to go ahead and click on this result because there was a match. And you can see discharge comes in a few places here. But this is where it's nice if you wanted to know, okay, what happened, or what was the discharge disposition for that patient? Okay, this patient was discharged to XYZ home health care. So you're able to follow up with the care or what happened during that encounter for that patient. So I would say most of our provider practices, if they're logging into the Connie portal, or once again using what we call the in context app right from their EMR, they've probably a lot of the information that they're looking for can be found here in the health records. This will give you your labs, radiology, and then also your clinical notes all in one place. And then from those various, what we call those data centers. So if you do have a patient that has received care at several places, you can kind of get all of that information in one spot. So I'll go over to next, structured documents. And so I talked about a lot of the hospital data. That's who we've been really working with this past year. You'll find under health records. You'll also find some of the hospital data here under what we call structured documents. But really, I anticipate as we get more ambulatory providers on board, this is definitely where you'll probably see a lot of the ambulatory provider notes, or what we call care summaries. So this structured documents tab are what where we have CCD documents coming in, and y'all keep me honest because I have a lot of acronyms that I use. And so I try to always, when I say acronym, I'll try to say what it is. So CCDs are what we call continuity of care documents. Most of the electronic medical record vendors, especially that work with ambulatory providers, do have CCD interfaces available. This is kind of the clinical data that happens in an outpatient practice. This is the way that the EMRs, those electronic medical records, will kind of send data to others. So, i.e. what we have now is called national network. So that typically the national networks, they will use or get CCD documents from ambulatory providers. But then Connie, we're also able to receive CCDs directly. And I would say most of our ambulatory providers, this is the way that they send us their care summary documents, or those CCDs, is right here, to Connie. And then this is where you see them displayed, is on the structured documents tab. I talked a little bit about national networks only because recently we did have the VA, the Veterans Administration hospital, start sending us in their care summary documents, or CCDs. So that's nice if you do have a patient that is maybe outside of the state. We recognize just Connecticut with so many bordering states, and patients that travel that we've worked with a lot of our stakeholders and are still kind of gathering, hey, what other data maybe are you missing when it comes down to care coordination for your patient? So we do have about 5 hospitals that border the state of Connecticut, and then the VA, of course, nationally, that is sending us their care summary document. So this is also a place where you can come and grab that, gather that information on your patient to do follow-up care. In general, I would say CCD documents, though, essentially have that care summary of what happened during that particular visit. So you'll see medications, you'll see immunizations in a CCD document, typically the vital signs that were taken, blood pressure, BMI, et cetera. All of that is captured in the CCD document. So a lot of information in here. This also, like on the other tabs, you can download as a PDF, and then that way, if you want to reference it or put it in, even import it into your own system, that is an option for you if your electronic medical record allows you to do so. So this is also downloadable. I had mentioned specifically with the structured documents, because it is a lot of information in those documents. One of the features that we are starting to work on is being able to what we call parse out or kind of take out specific sections. So that way you don't necessarily have to go through all of the different care summary notes in order to gather information on your patient. So recently we started with just extracting the medications out of the care summary document. So I'll show you where that lives also in the Connie portal. The last section I'll show here, and this is not really populated right now in our production environment, but we're definitely working on getting some live interfaces to gather immunization information. Is our immunization section. So we keep this in our demo environment just so you're aware that it's coming, because that's definitely something we've heard a lot about, like especially with COVID and just trying to keep up with vaccine status, et cetera, where you have that immunization information all in one place. So I will say coming soon on immunizations, but did want to let you know that that is absolutely in the works. So back over those. But this is really the bulk of what you'll find in your clinical information. It's, 1, my patient had an encounter somewhere. 2, okay, what happened during that encounter? You're able to go into health records and see the labs, radiology, any notes that happened during those encounters. Structured documents, this is where we find our care summary documents. And so, as I mentioned, we are starting to parse out some of the information that's in those care summary documents, just so you don't necessarily have to go through each one individually. It's nice if you're looking for one from the VA, you can specifically go to that VA document. But once again, if you're looking for like, hey, across all these documents, what was the medication for a patient, that's what we'll go to next. We'll talk about what we call medication management. So given kind of still thinking about, okay, where does this data come from for medication management? We also call this best possible medication history. What Connie does is takes all of those different CCD documents, specifically the medications that are in them, and then displays that information here in our medication management section. So once again, as we get more pharmacies, that's a big group this year we'll look to onboard, we'll be able to really build out even better medication history for a patient, just because we'll have more data sources that are sending in that info. But for now, the data sources we have, those CCDs, we do pull out the medications and display them right here in medication management. So that's why we call it best possible medication history. It's based on the information or data that Connie has received, or the folks that are actually sending Connie data live now. What's nice here in medication history, or best possible medication history, is you can see once again if there's any changes with a particular medication. I just hover my mouse right over that section, and it'll let me know that this dose has changed for this medication, or the provider has changed. It'll let me know when that medication was started, when was this actually captured. So you at least get an idea of the various medications that a patient may be on, versus, like I said, having to go through individually all of those care summary documents. It's summarized for you here. So this is our best possible medication history. The other piece that I always like to point out when we're in the Connie portal is the care team. So as we talked about before, the HIE really is more of that ecosystem where you can see all of the different encounters that your patient has had across, various care team members. And so if you want to even get a snapshot of, okay, who are the different people that are providing care for my patient, this is where you come to care coordination and you're able to see the different care team members. You'll notice here too that there is, once again, any place that we have like a flag or some type of specific message, you can just hover your mouse right over that. And this is just letting you know that there are members of the care team that may have certain behavioral health data, and that you just want to be sensitive with being able to access or share that data, because there's some rules around that. So that essentially is what this is letting you know, that you've got a couple of care team members that may have what we call 42 CFR Part 2 data, and that can't be reshared unless you get patient consent to reshare that information. So care team essentially just will let you know these are care team members. Once again, if you actually wanted to see results such as labs, radiology, et cetera, you'd still go to the health records section, but this is just at least giving you a snapshot of who is on the care team. We do also have, I've kind of collapsed the menu of different applications that we have available, but we do have what is called the provider directory. So if you did want to coordinate care with one of the care team members that maybe you don't have direct contact information for, you can go into the provider directory while you're in the Connie portal and look up that provider's information. You'll actually get there the direct email address that we have on board, which is direct, is typically used for securely being able to share patient data back and forth. You can get that. And then of course you'd have also the phone number and address, et cetera, for a certain care team member if you need to coordinate care for your patient. So I think the last section we'll go through today is just what we call PMP, or prescription monitoring program section. This on this particular test patient, we this patient, we just get to see the NARCS report. We don't have anything necessarily populated in here, but once again, this is kind of nice for many of our licensed prescribers. They like already being in a patient chart, maybe if they're about to prescribe something and they just want to make sure, hey, let me just check the NARCS report on this patient, especially if it's a controlled substance they're about to prescribe. You do have that automatic integration. If you have access to PMP already in Connecticut, we just essentially take that log on information, and that's how we use more of a single sign-on to get you logged into the PMP, just the NARCS report. If you're looking for other functionality, then of course you'd still go ahead and log into PMP like you normally do, but this was just a little bit of a shortcut, so you don't necessarily have to kind of log out and log into another system. We do have the integration with PMP here. So I know that was a lot to cover. Hopefully that was helpful. Once again, just kind of recapping everything we did thus far. We started off with patient information, which is demographic information on the patient. And then we went to clinical data. That's where we found our labs, radiology, transcribed documents. We saw care summary documents there. So really probably most of our end users or users for this system kind of will go to clinical data to find specific data that they need, clinical data they need on their patients. We talked about medication management, which essentially takes a lot of those care summary documents, the medication that's prescribed for a patient, and puts that information all in one place so you can kind of see a list of the different medications that the patient is on. And we have care coordination, where you can see the full care team, those others that are live in Connie. And obviously, as we get more data centers, that care team will grow, right? So you're able to see who else is caring for your patient. And then lastly, PMP, of course, wouldn't be available for all end users, but for our licensed prescribers, if you have access to PMP, we can also integrate your PMP NARCS report access right within the portal.